Good evening, ladies and gentlemen. Welcome to the Dawes County Board of Commissioners voting session. Today is May 20th, 2021. We appreciate those that are in attendance and those that are with us online. We'll start out with a roll call. And we're all here. I asked you to stand for brief invocation and pledge. Would bow your heads, please. Our dear gracious Heavenly Father, we thank you for this another day and the many blessings of life. We ask for knowledge and wisdom as we carry out the business of this great county. Anything that's accomplished, we'll give you honor and glory in Christ's name. Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may be seated. Are there any announcements? Any announcements? Okay, we'll move on to the approval of the minutes. First up, we have the minutes of the work session held on May 6, 2021. Any additions or deletions? Motions?
Motion approved.
Motion by Commissioner Satterfield,
Second.
seconded by Commissioner Dewey. Discussion. Hearing none, please vote. And that's approved 4-0. Next up, we have the minutes of the voting session held on May 6, 2021. Any additions or deletions? Motions?
Motion to approve.
Motion by Commissioner Fawcett. Second. Seconded by Commissioner Gaines. Discussion. Hearing none, please vote.
Are we done?
And that's approved 4-0. Next, we have the minutes of the special call meeting held on May 11th, 2021. Any additions or deletions? Motions?
Motion to approve.
Motion by Commissioner Fawcett,
Second.
second by Commissioner Satterfield. Discussion. Hearing none, please vote. And that's approved 4-0. Next up, we have approval of the agenda. I have several changes to the agenda. Just for note, item number 4 under new business, I'm going to move to number 1 under new business so that our person can get in here and get out and go to another meeting and do the same thing. So that'll be number 1 under new business. Also under new business, number 6 will be department restructure due to new election system and Senate Bill 202, Omnibus Bill, Elections Bill. Number 7 will be request for the fire safety fundraiser. Number 8, Fire Station 2 sanitary sewer easement request for emergency repair. And number 9, application for parade and assembly, Dawson County News, flavors of North Georgia. Those are the changes I propose to you to the agenda. Do I have a motion with those changes?
Make a motion, we approve the agenda with the amendments.
Motion by Commissioner Gaines,
Second.
seconded by Commissioner Fawcett. Discussion. Hearing none, please vote. And that's approved 4-0 with the changes. No one signed up for public comment in this segment.
No, sir.
We'll move on to zoning. Before we get into that, I'll go over the rules that we will use in the zoning process. First, the planning director will present the application and recommendation of the planning commission. Then we will hear from the applicant. After that, I'll open the hearing. We'll hear for those who are in favor of the application. We will hear from those who are opposed to the application. Each person wishing to speak will be allotted 3 minutes per our zoning guidelines. Anyone who speaks will need to sign in and give us your name and address. And also, if anyone has donated $250 or more to any candidate, you will need to fill out a form stating so. And Kristen, do you have those?
Yes, sir.
Okay. All right, so those are the rules we'll go by. So zoning ZA 21-09. Tim Hamby requests to rezone tax map parcel 106-051, 106-051-015, and 106-051-014 from RA Residential Agriculture and Vacation and VCR vacation cottage restrictive to RSR residential sub-rule for the purpose of combining and subdividing the parcels per the RSR standards. Jameson.
Thank you, Chairman. Mr. Hamby is seeking to rezone his property located off of Dawson Forest Road and Paddock Place. It's currently VCR and RSR. He's looking to rezone to, it's VCR and RA, and he's looking to rezone to RSR for the purpose of combining these three parcels and then subdividing them into newly created parcels. Currently, they are 8.97 acres. And he wants to subdivide it into 4 tracts, 3 of which will be 1 acre, and the 4th will be 5.97 acres in total. The future land use map in our comprehensive plan currently has this area as commercial office institutional, but as you know, we intended on this to be a commercial corridor, but it really didn't develop like that. It really is a residential corridor in which RSR is the appropriate zoning classification that when he met with staff that we directed him toward. The planning commission heard this and they recommended approval of this request 3-0 with no stipulations.
Questions for Jameson? Thanks, sir. We may have some later. Is the applicant present? Come on up. Tell us what you would like to do. If you will, you sign in for us there. I
How y'all
would
doing?
appreciate it.
Yeah, he laid it out pretty good. I don't know what's more I could add to that. Except for just wanting to get it rezoned. I've got, the bigger parcel. I've got it sold. There is a house on it. That's family land that I've had, or I grew up on. And that's kind of the last of it. And my dad, he's elderly now and he's, been through some strokes and some other things like that. So I'm moving him. He's lived in the house, so we're moving him closer to me so I can, just be closer to him for the rest of the time. So that's just kind of what I want to do.
Questions of the applicant?
You said there was already a house on this 5 point.
On the
Okay.
bigger, on the 5 point, I can't remember, 9.7 or something like that. it
Is that house gonna stay there?
Mhm,
It's gonna stay there.
Mhm.
Is that where your daddy is now?
mhm,
It is.
yes,
So you're selling that.
yes, selling that and I'm keeping the other 3 lots. I'm either gonna build on them one day or sell them or something like that. I'm not sure exactly which direction I'm gonna move, but I had the land left over, so I was just trying to get it in and to go ahead and get it surveyed into single lots.
So you're yourself are not building on these.
Mm-mm,
Mm-mm. Just so you can sell it.
yes.
Is that-
Other questions for the applicant? Thank you, sir. We may have some more later. At this time, I'll open up this hearing. Is anyone here to speak in favor of the application? Anyone here to speak in favor of the application? Anyone here to speak in opposition to the application? Anyone here to speak in opposition to the application? Seeing none, I'll close that hearing. What's the pleasure of the board?
Make a motion to approve.
Motion to approve by Commissioner Dooley,
Second.
seconded by Commissioner Satterfield. Discussion. Hearing none, please vote. And that zoning application ZA 2109 is approved 4-0. We'll move on into new business. First up, we're going to do consideration of the 2021-2022 Dawson County proposed healthcare package. Brad, you going to start that off?
Good evening, Mr. Chairman and Commissioners. I have with me Todd Hooper from MFP. You had some questions, Commissioner Gaines, concerning the application that employees that participate in the healthcare program could use, and eventually, hopefully, that might help us with our claims analysis. And he's here to present that. He's done the research. We've talked about it. He's going to present that, and then we can go on to answer any questions about the healthcare plans themselves.
Okay.
I believe you all have that in your package.
I think you got a handout here.
Or a handout.
Thank you so much. And following up on the last meeting we had, Mr. Gaines had brought to our attention to look into a employee healthcare engagement tool. One of the conversation pieces was a company called Rightway, as well as we looked at another company called Health Blue Book, which we are familiar with. You'll see that we've got those laid out here in kind of a very narrow format. So our placement specialist who worked on this case all through the time on the medical piece, and along with Tammy Starkey, our vice president, interviewed both of these companies, looked at them. I was on the call with them, asked a lot of questions. And obviously with the carriers, we have Anthem and Cigna. They have their own application. But when you look at the Health Blue Book and Rightway, those are a little more, I'll say a lot more progressive, in my opinion, in what you're trying to achieve. The carrier apps, if you will, are more along the lines of informative along the lines of being who are your in-network providers. They will provide information on what we call centers of excellence, given how physicians and facilities are graded on their healthcare cost. At the same point in time, they're able to help you understand how far along in the year are you with your deductible, your copay, your out-of-pocket expenses. And obviously, when we look at something here that's very straightforward, or something called require file feed from carrier, obviously the carrier app, you don't have to have that. And then at the same time, it allows the employees to just basically use their app to show their ID card. A lot of times that's a big concern whenever we're rolling out a new year. Now, when we look at Health Blue Book, Rightway, those types of companies, obviously, they are not the carrier. So when we look at how they integrate, we have to be in consideration of what type of file feed that we get from the carrier. Is the carrier willing to give that file feed? And then are there charges for those types of things? At the same point in time, when we look at those types of apps, a lot of times they're more conducive to be used with a self-funded type of plan because it is your information, although you can use them with fully funded plans just like yours. I think a big part of the puzzle that we looked at, Brad and I had discussions on, is obviously the carrier apps are at no cost to you. The others do have a per employee per month app fee. And one of the things we want to make sure is if you're going to spend that kind of money, that we have the employee engagement that we need. And as part of that process, obviously, getting employees engaged is a big challenge. It doesn't matter where you're at, just getting them informed from the standpoint of just enrolling. Typically an employee wants to know what do you have, but their health care is different than somebody else. So that's the first hurdle we get over. And then introducing the app to an individual. We talk about the telemedicine. One of the things that I think is a huge piece of the success of telemedicine that you all have with FlexCare Digital is that they actually send someone on site to make sure that when that employee enrolls with their health care that year, that they show them how to download that app. Because one of the things that we look at pretty quickly, even across all of our business, is everybody may have telemedicine, but at the same point in time, unless they actually engage that piece, they'll never use it. All that to say, getting the employee engaged is going to be very important. Education and how we do this from a standpoint of getting them to use it will be very important. So getting feedback from any of the carriers that you choose or any of the providers that you choose here, we need to be sure we got some type of utilization threshold that they can report to us. That being the case, the two carrier pieces you see here, again, are more informative. I think driving at what Mr. Gaines was getting at, we want to use the healthcare technology to not just be informative and provide some direction, but we also want to be able to use it to help what I would call steerage and inform the employee and incentivize them through your wellness program to actually use the app and use it consistently. Part of that, what we look at there and we got feedback on was with Right Way, the information that they provided to us was that typically what they see is with your chronic conditions, the patient, the employees who have chronic conditions, we see a much higher engagement with them. And you can see up to about 26% reduction in their claims costs whenever they use the app, okay? That's their general, their metric. At the same point in time, when you spread that across all employees, what you would expect to see based upon their metric there would be about a 13% reduction in claims. When we looked at that amount, what is 13% of your claims? And using the percentage that we looked at, I think your claims this year that we measure about 90%, run about 90%. A 13% reduction would be about $460,000. That would get you down to around 3.2 million. What does that equate to for us? Obviously, with your carriers being in the pool, you don't have a rate guarantee because you're pooled. But whether it was Humana or whether it was Cigna, you do get rate guarantees. And when we put that back to the rate guarantee, look at what that would be, that would get your claims to down around 78 to 79%. So when you're looking at 78 to 79%, that would equate with their rate guarantee charts to about a maximum or not to exceed 5% expectation on your increase in your claims. So again, with all that being said, I think a big part of what we would ask you to consider is with respect to the carrier apps, regardless of which carrier you choose, do we want to go a conservative route and build up the momentum and engage the employees to use technology? And then if we decide to go further than that, and our recommendation between these two, Blue Book and Right Way, if you go that route, would be to go with Right Way. What would be the expected participation in that program if you're going to spend money on that? We want to see as many people as possible use that. Obviously, those individuals who are experiencing chronic conditions. You'll notice, you heard me talk about incentivizations. Right Way, at the same point in time, they do build that in. Healthcare would have additional fees if you wanted to build incentivization in. How does the incentivization work? You can set it up different ways. First of all, you can set that up to where if they chose a particular specialist, let's just say again, I think I used this last time, a colonoscopy that was going to be performed. If they use this particular center of excellence, then because that individual is highly ranked or that provider is highly ranked, the individual may receive an incentive of $100. If you use someone that's lower ranked that may perform more tests, they may not do as many procedures, the cost is higher, they may only be incentivized $30. So it does help to control claims cost in that way, not to mention what you're already trying to do with your wellness program and expand that as well. That in and of itself is kind of where I see the mature piece of this being is incentivization to drive the healthcare cost claims down, but also the big piece is how do we get employees engaged to actually use this? Because it saves you on claims, it prevents these unsightly increases that are proposed each year, but you also want to look at trying to share those savings with an employee too.
What have people done that have used this to incentivize people?
Well, I'm going to tell you, I mean, and when it was brought up, I thought it was a novel and great idea because nobody brings it up to us. And here's what happens. We're big on wellness at NFP. We believe that you can't continue to pass on premium increases. You can't continue to pass on deductible increases, those types of things. You've got to address the claims. So these types of pieces coming out, as you can imagine, wellness is a disruptor sometimes. It's uncomfortable. At the same point in time, it costs money. And I sympathize with exactly where governments are at. So it depends on you as a body, I think. Do you look at it as an expense or do you look at it as an investment? And obviously, if we're talking about, I think this year, around $16,000. But if you can reduce your claims down to 79%, and I believe that's around, like I said, saves you about $460,000 in claims. That equates to savings in your premium. There is a return for it, but that return is going to be very, very highly driven by the engagement. I use it. People are comfortable with the providers. Are they willing to change sometimes? Some are, some aren't. Depends on, our culture, where we were raised, where we come from. But to answer your question directly, we don't have anybody using these. We would like for them to, but we don't have anybody doing that. You have healthcare wellness dollars that obviously the carriers are providing. At the same point in time, they want you to use their app. It's no cost to that. But I look at it from a standpoint of it's just an additional way to inform the employee, because a lot of times when you go to a doctor's office, they don't even know what a drug costs. And I'm not being negative toward that. It's just they're on a timeline to produce results. And sometimes patient care gets lost in that. So who has to take ownership of that? We hear the term consumer driven. The consumer has to become more educated. And how do you do that? Through experience, typically. And a lot of times they don't understand how much they can save by going places. So it is a disruptor, but from a standpoint of myself and NFP, we're a heavy believer in understanding how you spend your healthcare dollar. But most people or most consumers, they go down the hall and they get what they're told to do. I mean, that's just the natural, traditional way. A piece of this now, I will say, when we talk to Right Way and Health Blue Book, is people look at their deductibles and their out-of-pocket expenses. There's a mixed opinion about providing that piece. From your standpoint with the carrier pieces, they want to know that. That's what the employee wants to know. Where am I at with my deductible? But when you talk about incentivization, both providers brought up the piece of conversation around, well, if someone is looking at their deductibles and they're out of pocket, they're pretty savvy until they hit their deductible or out of pocket. And then that's when it becomes, they're going to do what they want to do. But you got to stop and think, how many people really hit their out of pocket maximum their deductible? I don't see that as a big concern from my experience. I see the argument about it, but I don't see that from my experience that would be a deterrent. I think people still want to save money.
To me, the Right Way, the model and what it brings is, and I use the word concierge service, and it's liaison between the employee and the health insurance company. The health insurance companies, no matter what name is on the building, is horrible at communication with employees. I mean, with their insureds, because you never know what you're going to get. I mean, and I think a heavy user that might hit their maximum out of pocket, they're getting bombarded with bills that they have no clue what the bills are for. A service like this comes in and takes that stress off of that employee. So I see it as a bigger benefit in that scenario where they might not care where they're going, but they're getting bombarded with these bills. So they're still engaged with this third-party app, because that app takes that on and says, we'll handle and figure out what these bills are for, whether you owe it or not. And to me, that is a benefit to an employee is worth the $5 a piece. We are going to see, I'm confident we'll see an ROI on it. And then especially if we change carriers, especially if we were to consider going from Anthem to Cigna with that disruption in their mind, or a change in general, having a concierge service that's walking that employee step by step through processes or understanding what deductibles or what their plan looks like. I mean, I'm in the insurance world and I can't tell you half of what this stuff means. But having that third party that holds their hand and walks them through that process, I think is a huge benefit that employees probably won't realize it until they utilize it. And it's the same thing with
That's the
telemedicine.
problem.
We pay for telemedicine for every single employee, and we cover that cost, I think, 100%. And you don't know how great it is until you use it. And we're talking about utilization. And once you use it, I think you start re-engaging in it. So our first year, we might not see a huge utilization, but I think as more and more people use it, just like Teladoc, if we go back and look what our utilization percentage was day one when we offered teledoc versus what it is now, hopefully it's gone up because people are understanding it more. It's a new idea. It's something new to the marketplace. I think there's a lot of different companies that are kind of trying to position themselves in this space. And I think it's a good idea. I think it's a good idea, and even more further beyond that. And Brad and I were talking about this earlier, is how many calls does Brad's office field on from an employee saying, well, what do I do with this? Or, do they cover this? And from a time management standpoint, this is almost like hiring a
Another
part-timer to handle those questions. So it should take, in theory, it should take some of the workload off of our current staff to be able to focus on other things and be more efficient in their roles. I like the idea of it. I mean, I think it's in multiple ways, multiple facets, it creates a return on investment, not only monetarily, but morale for employees as well, just because it's a benefit.
And to drive home that fact, that engagement, once you don't get just a canned plan with these. They give you an option of what you can choose from, and it's up to you how you want to build incentivization. And I think to your point is telemedicine is great. You don't realize it till you use it. We can talk about it all day and in here, but the guy on the road out there that uses it and then he tells someone, that's where your biggest return is, because it worked for somebody else, not for us, but for somebody, just like them in their mind. But I would encourage that if you're going to pursue this, I think we need to get with your administrative team here, do a strong evaluation of the provider, what they can do, what they can't do. Obviously, we may not want to jump in head first, but we definitely want to wade in and implement it so that it is successful. After the first year, I mean, obviously I personally don't believe you want to evaluate after 1 year, but after 2 years, 3 years, you'll see where that return is. And they give you metrics. I mean, how much is it utilized? What types of services is it utilized? I mean, there's no identification information in there on employees or anything, but it gives you an idea, because when we look at your claims, we share with your administration, here's the types of high cost claims we have. Here's the medications, here's the underlying conditions. Now, all of a sudden, I think the big piece is, how are people using their healthcare program, or are they using it? And then if they are, how consumer driven are they? So that when you see your premiums, your claims, when they go down, obviously, how is that being managed? Is it just because of the network, or is it because of your employees? And that engagement, I think, is a huge piece, in sharing that through an incentivization program at some point, if not the first year, would be very huge in the success of that program.
And you got an asterisk down here. Right Way can add $0 copay telemedicine for $1.50. We have we have another one that we already utilizing? Is that a more competitive telemedicine or no?
We do have another telemedicine.
So would that replace what the other one we have?
Would that be able to replace them full?
You could add that. FlexCare Digital actually sends a representative. I think it went down, it was like $6 something. It goes down to $3 or $4 this year. Yeah. So you'd be looking at $4 per employee per month. They actually get an app with that, and you have a representative that actually engages them with enrollment to make sure they download the app. And you heard me say that earlier. A lot of times we have voluntary programs. The employer doesn't provide it. Well, one of the big things that we look at is come January 1 on a calendar year basis, how many people have actually went in, called, set themselves up. And if you look at just say you've got 90 people enrolled and there's only 20, that's not a good situation, because that other 70 is probably not going to use it. And by having someone that gets them to set that up right away, prevents them from being sick and having to go through what I call the emergency room, diagnosis of all your problems and your height and your weight and all that. You get that out of the way. So I would say what you have in place is a very good program, but there's a differential that you're paying now of about $2.50 more than what this would
Yes,
be.
I mean, it makes sense to me, especially if we're trying to increase our utilization, having one platform instead of two platforms. You're driving everybody to one thing. And I just ran the numbers quickly. If we're paying $4 now for the telemedicine that we have in place, and we added on, say, the right way at 550, that's 950, but we could do the right way and their telemedicine for $7. So really it's a net difference of, is it $3? I mean, so it's,
What I want to clarify though, and again, I don't, it's not on here, but your per employee per month, typically what you would see here is probably those individuals that you are getting enrolled in your medical program versus all employees, where the current program, even if they're in the medical program or not, are covered. So if, let's just say, if you wanted to cut, let's say you want to cover 300 employees, then instead of paying $5.50 plus $1.50, $7 for all 300 employees, I think they're going to require that $5.50 on all employees, even if they don't have health care, where what you would be doing here is actually using the $5.50 for only those who have signed up.
well, that would be stupid for them to require the 550 if they don't have anything to provide services to them other than the telemedicine.
Yeah.
I'd like to verify that.
Yeah, that's why I
So
want to.
currently with our telemedicine, and with what we propose, still using telemedicine, and they use a back office or another provider
Mhm.
called Sirius MD, we would save about, at our current rate, $6,912 a year, because they go from $6 an employee to
But we could go to $1.50 here. Why would we not consider that?
You're,
Right.
you're, I think the challenge is we need to clarify. Like if you're gonna have this offered here for all your employees, you wouldn't offer it to people who are not under your health plan. So you don't want to have to pay $5.50 for those who are not under your health plan to get the telemedicine for those. So I think that's what we need to clarify.
I mean, in that case, they can utilize the other one. I know there's efficiencies of scale or whatnot, but I mean, that's, you're talking $9.50 versus $7 and you multiply that out times 300 people, that adds up quickly. And we can almost absorb a big chunk of this fund and add an additional benefit for $3 versus versus $5.50 plus $4.
Yeah. I completely agree with you on that.
Do we know how many employees that are not enrolled in the insurance actually utilize the telemedicine?
I don't think we are privy from
To
your
that.
standpoint to how many that are not in that program. I
Right.
mean, I can ask, can they delineate something like that, but I don't know they have that information.
I was just curious, if it's just like two that's not enrolled, then is it,
Mute point.
right?
Mhm.
Yeah, because you have, I think what we see is around 270 eligible employees, and I think you have around 240 that participate in the program.
That's correct.
And then you have the part-timers that you added to this program a couple years back.
And I know they were working, Chrissy has been working with Christy to get those numbers on our organization. You know, we've got the telemedicine program, but how many people really
Yeah.
use it? And to be honest with you, I don't remember.
And the strength of having that telemedicine program is, for the most part, and COVID has kind of created some anomalies about not charging for employees to use it. But outside of that, having your standalone telemedicine, zero copay, usually your carrier is going to require a copay like $35, which is a disincentivization. Plus, if that's a $180 charge that they're incurring for that physician, that's going to hit your claims. Now it's not hitting your claims. So when you do look at utilization, those dollars are not going towards your claims right now.
Other
So
questions?
We can clarify. We'll get
Yeah, I would
clarification.
venture to say, and this is an assumption, you know what they say about assumptions, but I would assume that Right Way is not facilitating the telemedicine program. They're probably contracting that out. So if they're contracting that out, then whoever they're contracting that with potentially would pick up the other scope of anybody that's not on the Right Way program potentially.
Yes. So like if an employer pays it, typically we'll see a fee of about $6 on Teladoc. But if an employer is not paying it and it's voluntary, it can be anywhere from $8 to $12 per employee.
We're still paying it. We pay them all.
You do what now?
We pay for all employees, so it's all employer paid.
Yeah, you're currently paying $6 per.
Yeah, so in that, I mean, based on that, let's just say that Right Way does we do the 550 plus we add on the $1.50 per employee that is on the right way plan, but if we have somebody that's not on our medical plan, they don't need the right way features because there's nothing there other than maybe the portal to get to the telemedicine. And maybe the contracted telemedicine provider would add those employees on at a increased $4 or something like that.
We can ask that. Absolutely.
Other questions? Okay, a couple of weeks ago when you presented this, or 2 weeks ago, recommendation was for Cigna. Is that still the recommendation?
That's correct.
I know we've had some employees that have contacted. I know I've had a couple of contact employees, and some of y'all may have also had some contact with employees. And I think, David, you said there'd been some employees that had some questions. And I think Mr. Gaines brought this up, I believe it was 2 weeks ago. One of the biggest concerns is the doctors and making sure that the list is similar
Yes.
to what
That's
they're
what they've been telling
currently
me.
is, and I don't know if y'all been able to delineate any of that in the last 2 weeks or not in reference to that. I tried to look up Cigna myself today to see what their doctor list was, to see if my doctor was on there, and I had a little bit of trouble navigating their thing, and it wanted me to sign in, and obviously I couldn't sign in because I'm not in their system. So I didn't get an opportunity to look at their list, so I didn't know if y'all had an opportunity to answer that question. I think he had asked as well.
So one of the things we did look at early on in the process is the decrement to providers. What would change? We start off with 8 or 9 plans and we get them filtered down into. Cigna did have some plans that just weren't acceptable. The doctors were down around, Alpharetta, towards Atlanta. So we take that off the plate. So what we do come up with is we look at dental and vision as well. And the plans do match very close together. Now, having said that, we also have to understand, as Anthem did last year, throughout the year, there will be doctors that are added to the network. It's not something we can control. And some that will leave the network. Some of that's driven by the carrier, and some of that's driven as a business decision by that particular practice. And also Commissioner Gaines touched base on it. We looked at some of the customer service issues as well, and I think we've all gotten a little bit of feedback on that. I've got a lot of positive feedback with Cigna. Had one negative comment. It was general in nature. And I did look at a consumer website, tried to make it scientific. And when you look at the star ratings that they're given, they're off a little bit. Overall, Anthem's got a little bit better than Cigna, but they run pretty close. They run pretty close together. Then you have to dig even deeper and analyze them and say, well, this person has one of those plans that whoever did their benefits didn't consider the area providers. You're always going to get a few of the medicines that aren't covered. You can't get it one plan for all. There's going to be a few providers, as we know, that aren't in all the plans. But we do our best job to try to align all that up. When you look at the differences, the deductibles with Cigna are a little bit lower when you get in out of network benefits on the POS side. They're going to cover the diabetic equipment and supplies, and Anthem has agreed to this as well now at 100%. Anthem didn't before. And Cigna will cover durable medical supplies such as crutches, wheelchairs. Anthem didn't agree to that. How much does that really weigh into it? Out of 240 employees in the plan, how many really need wheelchairs? So I think what Todd had said last time is the economically Cigna's the best plan, but I also think when you try to compare them as best as you can, it's the best comparison to apples and apples that you're gonna get. Anthem has come back to the plate and tried to work with us. They're showing, I'm pretty sure you have this, a 3% increase,
Mhm.
which would be a $119,000 increase in annual premium. And Cigna actually showed a negative amount over our current premium.
And one of the things too, in reference to that, on Cigna, when you add those two numbers together, the 1,836,634 and the 2,144,098, it doesn't come to that 3,930,733. It actually comes to 3,980,732. So it's $42 difference instead of 49,000.
What you got on that bottom number there, if you look at the top, there is a $50,000 credit that's
Mhm.
packaged in there. That's not reflected in those
Okay.
rates, and that is actually a direct credit to the
Okay.
county there.
Look, the chairman asked us a couple weeks ago to do a comparison of the different benefits between the counties. And I think we're waiting on 3 more counties to come in now. But I did talk to one county, Habersham, who's had Cigna. And I wanted to get their feedback on it. And they were pleased with it. They've had Cigna for 2 years. It wasn't one of these plans that we talk about where a lot of providers
Right.
are excluded. It was a pretty good plan, somewhat like what we're offering here. They were generally pleased with it. And the only reason they're switching this year is the premium amount with United Healthcare. They comes down to, again, economics with them. But the woman I talked to in HR didn't have any big complaints with them, aside from some of the things we've already talked about, like, a misunderstanding of the plan or somebody thinking, not being able to cover everything.
One of the things too, not knowing anything about insurance whatsoever, what is the difference in, when I'm looking at it at the top there, we're under funding, it says fully insured and then 50% dividend eligible. What does that mean?
What that means is basically you've got a pure, fully insured plan over here with Anthem. Under the Cigna plan, they're giving you that credit we just spoke about. Obviously, it's on the front end of the process. But the dividend plan, keep in mind, we have a rate guarantee that's been built in there. So you kind of have a knowledge of what the expectation is. But from a standpoint of if you come back at the end of the year and any savings that you have, they're going to give, I shouldn't say any, but they're going to give you a 50% split of that, provided you renew the second year.
Right.
But if you don't have any savings, you're either going to stay or go anyway.
Right.
And that is based upon typically, they've got it worded, but it's around, I want to say there's like a 75% loss ratio, and then there's some fixed costs they have on top of that, administrative costs, and then they split it between that differential right there. So they're incentivizing you really to address what we're trying to do with claims.
Right.
And not just giving you a lower premium, but sharing some savings.
Sounds like a plan.
And one other thing I just want to touch on briefly is Cigna, I believe, was going to include a $20,000 wellness fund. Anthem has $15,000 plus ACCG has a $3,000. And Christie, monitors and promotes the wellness plan here. Right now, she has 70 employees involved in it. I think last time I had her prepare the report, it was around 60. And we're entering the end of our year. So we're going to see that number increase between now and July 1st because people want their money. They're bringing in their documentation. So and kind of what we've talked about before.
It works. I got mine.
Okay, good. So I mean, that's really good. But again, let's see what happens next year. It's going to be better.
About the positions, one of the things that at NFP we do is we look at the formulary and then we look at the network disruption. And as Brad alluded to,
I need you to get a little closer so we got people to hear you.
as Brad alluded to, different plans have narrower networks. They're going to have a lower premium. but you're going to have disruption, you're going to have unhappy employees. And he mentioned both carriers have what they call a high performance network. With that, there are certain providers, there are certain hospitals that are in or out.
Mhm.
But there's a high amount of education got to be involved, and we don't want to see people just jump to a plan because of premium, and then you hear about it, six weeks later because it didn't pay. But what we look at, as I was saying earlier, is we take your prior year's claims and we actually run those through with the new carrier or a different carrier that we're evaluating to see would that have been in network or out of network. Your top provider or your top claims provider was Northside Hospital. That's kind of an easy one. But as you go down the list, and it was a pretty extensive list that we looked at initially on to say who's in network or who's not, because that, to be honest with you, that's where we start at. And I know Humana had some disruption, but if I'm not mistaken, Cigna was about 100% match with Anthem on that, or slightly, maybe 2 or 3 that was not. So I just wanted to answer that question that we do look at that.
That's the reason we pay you. To do a good job.
Yes.
Thank you.
So,
Any other questions?
Are you saying that, if the in-network that people are buying large if we go with Cigna, that people are buying large gonna get to go to the hospital they're familiar with and go to the doctors they're familiar with?
If we replicated last year's claims
Mhm,
and we look at the top claims, I want to say it was like 35 lines maybe in there of who we looked at from the top dollars all the way
Mhm.
down.
mhm.
There was no disruption or 1 or 2 at the very bottom of it, but I'm going to say it was 100% match at that point. So to answer your question, essentially, yes. And a lot of that, and I have to say, I mean, I can tell you a particular client, I've got a orthopedic provider that's in Carrollton, Georgia, and they've got an office in Villa Rica, Georgia. If you go to one, you're out of network. If you go to another, you're in network. Okay. So it can depend on, is it Dr. Todd or is it the TIN of the facility?
Mhm.
Okay. Because they have their own discretion at how they look at that. So we have to be real careful about that.
Yes.
I mean, you have to, get the question asked about.
Now I can speak to that because, yeah, sometimes when you go to the doctor who is in network, and they have a PA, if you see that PA, they're not in network. So you have to make sure that they do their appropriate paperwork at the office to make sure it works.
It really comes back to this piece we're
Yeah.
talking about.
Yeah, exactly.
For some
Comes back to
reason,
that concierge piece.
Let
Yeah.
them do
I've
that.
got to have that. It's like I say, a teacher is an educator. They're not an insurance person. Doesn't matter what degrees or what they have.
Yes.
It's foreign to them. And the better you can help them understand, educate, the better off the experience is going to be for them and then for your human resources office, so they don't get those complaints. But hopefully.
I think you also talked about, was it 2020 or 2019, where the Anthem North Side, there was some disruption within that because there was some negotiations going
Northeast
forward. So-
Georgia.
Northeast Georgia.
Northeast Georgia. So there
Oh,
was some
yeah.
disruptions within,
Yes.
even with Anthem. So that can happen with anybody, but
You have that happening with United Healthcare right now in Northside Hospital.
okay.
It's not the entire relationship, but it's isolated. It could grow. So we have to be careful about that. I've got one entity right now that both hospitals within 20 miles just sold. So we had to have a conversation to make sure one was with Piedmont and one was at Advent Healthcare, just to have the conversation. Does the carrier participate well with these, or do they anticipate any type of disruption? Because today is great. You
Yeah.
sell, it closes in September, and all of a sudden I got a problem.
Mhm.
Well, that goes back to what Brad said too, and you've said is, doctors come and go
Mhm.
in networks and out of networks.
That's right.
One day they're in, next day they're out. So
Well, unlike some of the South Georgia counties, I mean, we're extremely blessed and fortunate that we have really 3 different, I mean, we want every employee, if they got a relationship, to be able to continue with that relationship, but the same sense is we've got a lot of providers within, I mean, we're like in the hub of where all these providers are trying to buy up market share. So we got Northeast Georgia, and we got Northside, and we got Piedmont coming over. So we do have access to a lot of different options.
You do.
One of the things we found last year is having that Anthem card, and you put everything under Anthem. Been told, Vision as well, as the employees really like that. It was Cigna, we had the same thing, we had everything on one card. This makes it easier when you're out there shopping, you have to present an ID. How many cards we carry in our wallets and receipts and whatnot.
More than enough.
Right. Can reduce that.
So from a procedural standpoint, you guys need a vote tonight on which carrier we go with from the ancillary component with the right way situation. There's still some ambiguity that you're going to clear up, so we could technically move forward on a decision on the carrier and plan, but then maybe next voting session, you would have those answers and we can decide which path to go down then.
Yeah, we would want to very much engage your administrative team with right way and get questions answered. I mean, last thing I want to do is buy it and not end up
Yeah.
doing what you want it to do. Obviously, it does what it wants to for educating and being a consumer piece for your employees. But if you're going to build some incentivization in it, how that's handled, the file feeds, that's going to be a question we have to get with the carrier to make sure will you send the file feed over? We need that to happen.
And as well as the Teladoc.
Yes, that'll be a big piece.
So we don't have to vote on Teladoc tonight either.
Do we have to vote on any, or do we have to vote on a big piece?
Yeah.
We're getting the
We
carrier.
We need to.
We need to, so that they have time to get it done.
Mhm.
Yeah, the telemedicine piece is in there because what will happen is once the vote's taking place tonight, we immediately build a book for our side of the B-Swift enrollment system and administration system. And then we also let the carrier, regardless of which it's life, disability, or medical or telemed, we let them know, and then we got to send over an eligibility file to them so that come July 1, your employees have coverage. At this point, with telemedicine, that being a concern, I don't know that you have a written contract with them, but I'm sure that they would continue to extend that over. And we could enroll in it if we have to.
Well, I mean, if we
Or we
take
could
2
cut-
weeks, I mean, if you have 2 weeks, surely you can get those
We can cut that button off.
answers done and then we can have an answer before we implement July 1st.
Yes, I mean, that's not a big thing. The medical is huge.
Right, the medical is the
That's not-
important
Yeah.
piece. Yeah, that's what I'm saying is finalize this one big piece and then the side
Yeah.
shows.
And we're prepared as NFP to honor your decision on whichever provider you have there that you want to choose. I understand that there's a tight relationship, and I think as Brad mentioned, what's the cost difference to the employee, how you want to handle that. Obviously, the rates, we'll need to have those, so we can put those in.
As far as between the two carriers, do y'all have any statistics on claim denial? Is one worse about, well, once you've submitted a claim or once you went to the doctor to have surgery or whatever? Is there any statistics on, is one better about approving the claims versus the other one? Are they about the same on that? That's one thing I
I
heard.
had
that-
heard
that
that people
Cigna
had
was-
had said that to me.
Yeah,
That Cigna really was big on denials.
yeah.
To be honest with you, I don't have an answer for
See,
that. I have
that's
not
scary.
looked at that
Yeah.
piece. Typically, when we see it, it's based on in-network, out-of-network.
Mhm.
Now, a big piece that you see across with all carriers is someone goes to the emergency room. And they will evaluate whether they really should have went to an emergency room or an urgent care.
Mhm.
That's where our call center, service center gets involved, like we will advocate, solve claims and that sort of thing. We'll have to get involved with the carrier on that side of a claim denial, but typically it's pretty straightforward to my knowledge. Unless it's not a covered service. And you have to be careful about that sometimes.
It kind of goes back to what I said before. We don't have this statistics, but looking at some of those comments, there was somebody who made a comment, and I'm paraphrasing here, that they mentioned that they don't cover things. They're a ripoff. Well, again, let's dig deeper. What really happened in that case? Because I know if I kept digging, I find the same thing about Cigna somewhere. So I just tried to kind of do a broad overview, not dig too deep in the weeds, because you don't know what went on, you don't know what kind of plan they had.
Each one's so unique. I mean, it's probably hard to.
Plans. Claims.
So
Like
the-
with tests and all, does Anthem do pre-authorizations? So you'll know whether, so if you gotta have an MRI. Do you go ahead and get that pre-authorization so there won't be any chance of a denial? I mean, when you go, you think, look, I got this, and they said, this is, I can have this.
Right, you should always do that to make sure it's covered, because you want to check that your doctor is in network. And we had a case where somebody was told they were covered and they weren't.
You want to make it even easier? Get a third party that gets involved and you call them
That's
and you say,
right.
go find out if I'm in network.
That's
And
right.
it's, if you
That sounds
call a doctor and say, "Will you accept, XYZ healthcare," they're gonna go, sure, it might not be in their network though.
Hmm.
And I learned that, so you have to ask. them, "Are you with
This is so
provider of
complicated.
XYZ?"
A big piece of what you asked is
I know.
this is a very spot on question because depending on, let's say, the type of, if it was an injury,
Mhm.
they may not want to cover that, or they may say you got to get an X-ray before you get the MRI. So it's going kind of like stealth therapy with the drugs.
Oh, okay.
So from a standpoint, would I perceive that as a denial? I would perceive that as a denial that I couldn't get my MRI, although I was able to at some point. It's just they're going to
Mhm.
require that to
Point in
avoid testing that may not be needed versus a bone or a soft tissue type of
Mhm.
I guess that
Mhm.
perception that the physician should have had an X-ray.
I just don't want to do anything that hurts the employees.
Yeah.
That's what I'm so
Yeah, the cost.
afraid about.
The cost gap between the two, now that we've got the updates, is $169,000. So we go with Cigna, it's a savings of right at $50,000 over what our expenses were over last year. If we go with Renew with Anthem, then we have to come up with an additional 119.
Mhm.
And so I guess the question is it worth the 169,000?
But they're telling me that they're comparable.
Mm.
That's what I've got
If
out
you
of
would
here.
have,
Did
if you would have
say
talked to
Anthem is
Habersham and they said it was horrible, that would be a different, that'd make me a
Mhm.
good one easier.
Mhm.
Yeah, yeah.
Mhm.
Yeah, your plan right now, and again, it's pretty straightforward laid out here in terms of an overview. You see how it matches up, and we wanted to keep the plan designed the way, obviously not change deductibles or out of pockets. Match that up. The real big change I think you see there is out of network is covered at 60% versus 50% with one carrier, and then where we're at now, both carriers will cover your diabetic supplies and equipment at 100%.
Mhm.
One carrier now will cover wheelchairs and durable medical equipment. How much is that in terms of impact? We don't really know, but keep in mind, when you're looking at the total dollar increase there, whether you pick that up or not, but if you continue the same cost share with your employees, you're picking up 70 to 80% of that cost. They're picking up 20 to 30% of that cost. So just wanted to point that out, under the current cost share, you would not be picking up all that cost.
Mhm.
And I think when we looked at the premiums, what were they? Depending on if it was employee coverage, it might be $3 to $4 per pay period difference between the two carriers. If it was family coverage, I think it could be as much as $7 to $9 per pay period. So just making sure we're transparent on
Mhm.
that cost down there, 49 negative versus the 119.
Other questions? Thank you, gentlemen. Pleasure of the board.
Well, I think I'm gonna make them, well, I don't have to add all that in there. On this big piece, I just think since I'm listening to what you're saying, that they're comparable, that I'm gonna make a motion that we go with Cigna.
Motion by Commissioner Fawcett to go with Cigna.
And then we gotta do this other, that's just
Well,
on
they'll
this
keep
big
working on
piece.
that. Yeah,
And we'll have more information.
they'll work on that. Yeah.
Okay. But that's my motion.
Do I have a second?
Second.
Second by Commissioner Dooley. Discussion.
So Go ahead. No, go ahead.
So the 49,000, I guess will come out of the 100,000 you got in budget for,
No, it's 49,000 less. than what-
Less.
We won't be spending any of it.
so we won't be spending any of it.
Mhm.
That's even better. Because I guess I'd like to, Chris is on that program.
Right.
We need to talk about that on, I guess, 2 weeks.
Yeah.
Yeah, I
But
would. ask-
What's our incentive? You know, he talked about incentive to the employees. If we could take some of that money that we've got it in healthcare budgeted to increase that incentive or do some kind of incentive, we'll get more people in the wellness program.
I think we'll know a little bit more about that after they give
Yeah.
us some more
I mean,
information.
I'd like
on
to
it.
use some of that money to give back to the employees.
Would you be willing to amend the motion to include the verbiage that would instruct them to bring back
In
the,
2 weeks.
I think he recommended right way based on the
Right.
analysis, bring back the right way plan with all the details that we needed to finalize, as well as the best, most efficient option on the teledoc.
Mhm,
If we
mhm.
can
I
have that.
amend my motion and what I said and then what Chris said. Have you got that? And then come back in 2 weeks. Have you got that?
Does that work?
I mean,
timing
this
wise?
is
Do we-
difficult.
Do we actually need to amend the motion? They're gonna bring that back regardless,
Okay.
right? There's no reason to,
Let's see.
We're just voting on the big piece now.
It just documented that we wanted.
I'm
it
asking
back
the
in-
attorney
I think the clarification is good.
Okay.
to add that.
Yes.
Mhm.
Okay. All right. Do I have a second on that amendment?
Second.
Second, okay. All
And
right.
I too, I want to say, I don't know if it's the right time, I'm always out of order, but I sure would like feedback during the year from employees, because I don't use this.
Mhm.
And as I've said, I don't want to do anything to disrupt the employees. I want to do what's best for them. So please, people, give us some feedback.
Because from what we're hearing now, they're the same plan.
And
And
that's
I want to
it.
make sure that they are the same.
I do
plans.
too. I do
Exactly.
too. So I'm done.
Any other discussion?
One final thing, it was also, I think, brought to my attention that one of the biggest issues I have as we go through this process year to year, and we discussed it at length last year, was the timing of all this thing. So it shortens our time frame. We don't have much use. If we do move to Cigna, then that opens up that time frame a little bit, is what I heard from y'all before. Is that correct?
That's correct.
Okay.
Mm.
Okay, thank you.
All right, we'll take up the amendment first. Any further discussion on that? All right, so we're taking up the amendment first, and then we'll go to the original motion. All right, so no other discussion on that. We're talking about the amendment only here. Please vote. And that amendment is approved 4-0. So now we'll go back to the original motion, which included the carrier, which was Cigna. So no further discussion on that. Please vote. And that is approved 4-0 as well with that amendment. All right, we'll move on. We have consideration of applications for parade and assembly 5-star NTP North Georgia Triathlon. That was presented a couple weeks ago. Jameson, come on up.
I just have one thing to add. We still have yet to hear back from GDOT and getting their approval. And so if this were to go forward, we haven't heard back from GDOT. It's the same triathlon in both the 5-star events that we are considering tonight, but one is on Saturday. So we want to hear back from them before 5 p.m. tomorrow, hopefully. So include that in if that's considered.
Okay, so we want that to be pending the
Yes.
GDOT approval.
Correct.
Any other information needed? Motions.
Make a motion that we approve the application for the parade and assembly for the 5-star NTP North Georgia Triathlon pending GDOT approval.
Motion by Commissioner Gaines,
Second.
second by Commissioner Satterfield. Discussion. Hearing none, please vote. That's approved 4-0. Next up, we have consideration of application for parade and assembly 5-star NTP bootlegger triathlon. Same thing? Same thing. Still pending GDOT. Any other information needed? Motion.
Motion approved pending GDOT's approval.
Okay, motion by Commissioner Satterfield,
Second.
second by Commissioner Fawcett. Discussion. Hearing none, please vote. And that's approved 4-0. Next up, we have consideration of acceptance of platted private roads to public roads in Sosby Creek and Sosby Point residential planned communities. Jameson sent you out an update in reference to that with a couple of options that you could look at. Any other information needed? Motions.
Is he gonna say, are you gonna say?
You
anything?
can.
Yeah, let's say.
You got a
something.
question from him?
Absolutely. So the
Just-
last work,
just-
session, just to bring us up to this
explain
point.
Some of this history. So we
Absolutely.
know where we're coming.
So the last work session, this board decided to move forward with a vote whether or not to accept or deny Sosby Creek and Sosby Point roads into the as public roads. Furthermore, the council brought up the fact that they recommended the change of the subdivision regulations before accepting of any other major subdivision plats. Since then, council and staff has talked and council has drafted a moratorium. It's a resolution of the Dawson County Board of Commissioners enacting an emergency moratorium on acceptance for approval of final subdivision plats that create new roads. And this is just a 30-day moratorium that we have on accepting these major subdivisions in order for us to get a time to put it before a public hearing in case we need more time to move forward and update our ordinance.
We got to update the subdivision ordinance. Is that what you're saying?
Yes.
Okay.
So does the motion need to include going?
I believe we would need two different motions. One about the Sosby Creek and Sosby Point roads as being public, and then one is the resolution.
That is correct. And I have a resolution for your signature if it passes.
Okay.
It was a 30-day moratorium, correct?
Mhm.
We'll take up the Sosby platted private roads to public roads, Sosby Creek, Sosby Point residential plan communities first. Pleasure of the board.
Oh. I'm not sure exactly how to word this because I don't know if it would be a denial. I want this to be private, not go public. So how would the motion be worded? That
You would be,
I would not, don't want to accept.
You would deny the.
you would be
acceptance.
denying acceptance
Deny,
of public
okay, well,
roads.
that's it. Want to deny the acceptance of the private road to public roads. I want to say private.
Okay, so we have a motion to deny from Commissioner Fawcett. Do I have a second? Second. Second by Commissioner Gaines. Discussion.
These are currently platted as private, correct?
That's correct.
Mhm.
Any further discussion? Hear none, please vote. And that's approved 4-0. Now we'll vote on the moratorium for 30 days. Allow time for, and does that go to a public hearing? Is that what we're voting on?
This is just the moratorium.
Just moratorium
Yes. And
Okay.
then there will be a public hearing.
as part of that?
Yes.
Can you define the moratorium once more?
Yeah,
for
well,
me,
you,
please?
can you read it? Have you got the moratorium,
He's
the
got it.
wording of the moratorium?
Not the whole thing, maybe just,
Oh.
just the title of what
Is
we're,
it that
what are we,
much?
what are we addressing in the moratorium?
Oh, I didn't know that.
Give us the highlights.
I'll read the most pertinent portions. The Georgia Supreme Court has held that a moratorium with respect to application of a zoning ordinance may be put in place for a reasonable time without the necessity of complying with the notice requirements of the Georgia zoning procedures law. Whereas the board finds a moratorium barring for 30 days until June 19th, 2021, the acceptance for approval of final subdivision plats that create new roads to be reasonably necessary, the least restrictive means available, a reasonable exercise of the county's police power, and in the best interest of the public health, safety, and welfare.
Okay. Any other information needed? Motion.
I'll make a motion that we begin a 30-day moratorium on accepting final subdivision plats.
Okay, a motion by Commissioner Gaines,
Second.
second by Commissioner Dooley. Discussion. Hearing none, please vote. And that's approved. 4-0. Next up, we have consideration of settlement agreement between Dawson County and the city of Dawsonville concerning special purpose local option sales tax, and that would be splosh number 7. We've been working with the city in reference to this, and we have now come up with an agreement. Any other information needed? Motions.
I make a motion that we accept, approve this settlement agreement for SPOS between the county and the city.
Okay, motion by Commissioner Fawcett,
Second.
second by Commissioner Dooley. Discussion. Hearing none, please vote. And that's approved 4-0. We'll move on to number 6. Department restructure due to new election systems and Senate Bill 202 omnibus election bill. Basically, there's 2 position changes and updates to those 2 position changes that you'll be voting on. There's no extra money associated with that at this particular time. What's the pleasure of the board?
Make a motion to approve as presented.
Motion to approve by Commissioner Satterfield,
Second.
seconded by Commissioner Fawcett. Discussion. Hearing none, please vote. And that's approved 4-0. Next up, number 7, we have requests for the fire safety fundraiser that was provided you information today from Chief Thompson, where he's going to be in the dunk tank. And Commissioner Gaines has volunteered to be in the dunk tank. Any other information needed?
What's the temperature of this water?
Haven't put it in the day before. There you go.
You're giving him ideas.
Yeah. Other information needed. Motion.
Motion to approve.
Motion by Commissioner Gaines,
Second.
second by Commissioner Satterfield. Discussion. Hearing none, please vote. That's approved 4-0. Next up, we have fire station number 2 sanitary sewer easement request for emergency repair. That was presented to you tonight by our Public Works Director, Ms. Farr. Any other information needed? Motion.
Make a motion to approve.
Motion by Commissioner Dooley,
Second.
second by Commissioner Fawcett. Discussion.
When will they start? I mean, this has been going on for a couple of months. Yeah.
Townley's doing that one, isn't it?
Oh.
So no date. Was he waiting on this approval? I know it's been backing up for a couple of months.
Other discussion. Hearing none, please vote. That's approved 4-0. The last thing we have on the agenda is application for parade and assembly, Dawson County News, Flavors of North Georgia. Heard that presented tonight. Any other information needed? Motion.
Motion to approve.
Motion by Commissioner Satterfield. Second by Commissioner Gaines. Discussion. Hearing none, please vote.
How y'all gonna advertise that?
Probably in the paper.
Let you listen to that.
He needs in the duct tape. No.
And that is approved 4-0. We do have need for executive session for litigation, so I'll entertain a motion to go in executive session.
So move.
Motion by Mr. Fawcett, seconded by Mr. Satterfield. Discussion. Hearing none, please vote. That's approved 4-0. Council, will there be any vote coming out of that executive session?
I don't believe so.
Okay, no vote. All right, we'll take about 5-minute break and then we'll go into executive session. Thank you for your attention.